Here is expert advice about how to answer difficult written station questions on the CASPer. A close friend of yours has been suffering from a terminal illness and his condition has been getting a lot worse. At this stage, there is not much that can be done to stop the illness from progressing, and it pains you to watch your friend suffer. He is unable to do anything aside from lying in bed. He informs you that he is considering asking the doctor to help him painlessly end his life. Question 1. What would you say to your friend?
A close friend of yours has been suffering from a terminal illness, and the condition has been getting a lot worse. At this stage, there is not much that can be done to stop the illness from progressing, and it pains you to watch your friend suffer. He's unable to do anything aside from lying in bed. He informs you that he is considering asking the doctor to help him painlessly end his life. What would you say to your friend? Again, another situational. You said, I would begin by acknowledging his feelings. Very good. I would want to know more about how he feels and ask him if he has tried other medications. Before we get to here, what else could you have expanded on as far as, go ahead.
I think for sure, trying to identify what he means by painlessly end his life to begin with. Is this more situational experience? Was this something that's more long-term? I think I was quick to assume that this was a decision he was making and then wanting to act on it.
Okay. Yes, but then let's get a bit more doctor. Doctor, what is your main concern here?
My main concern? Well, in my opinion, I see it as the well-being of the patient.
Yes.
So, yeah.
And what else? Who else should you be concerned about?
Maybe the ethical implications on me as a professional as well, if I am the doctor. But in this case, because it said I was a close friend, that's what I was unsure.
Yes. So here's an example. As a close friend, so I am really concerned about my friend. I want to ensure that he's okay. I'm also concerned about his family and his other friends, right?
Yep.
Again, expand your scope. So highlight all those who could be affected by his decision, both directly and indirectly. However, I am only his friend, so I could only give him suggestion, but I would want to speak with him privately just to understand his reasoning and to see what information he already has, right? Let's see what else you said. You said, I would want to know more about how he feels and ask him if he has tried other medications, therapy, or treatment courses that could help him feel better. I would tell my friend that it is his decision. However, he should also speak to his family and loved ones about how he feels. Again, that part, put it at the top to demonstrate your concern. I would help him to find resources about his options in medically assisted death, if that is in fact what he wants. I would support him in whatever decision he makes, since he is the one who is going through the pain. The content is good, but some more organization. So if, for example, after speaking to him to understand, his thought process, why he wants to do this, if after speaking to him, I realize that he's already done on his research, he has spoken to his family members, he has spoken to his friends, he has spoken to the doctors, he has already explored all other methods or treatments, then I will support him because that is, he has a right, the patient autonomy to make that decision. So I'll just let him know that I will be there with him and for him whatever he needs. If, however, I realize that he did not explore all his options, then together with him, I will work with getting him more resources and different options. I will encourage him to speak to the doctor to see what other options are there, acupuncture or other pain relieving options. If I also find out that he didn't speak with his parents, then I would encourage him to speak to his family members about this, this issue or his decision. Worst case scenario, you find out that he hasn't done his homework and he hasn't spoken to anyone about his decision and he's not willing to do so. In that situation, again, he has the right, because he's mentally, competent. So I would have to respect his autonomy after ensuring that, you show empathy, right? You'd have to respect his autonomy, And again, tell him that you will support whatever decision he makes.
Mhm.
Does that make sense? So now you have three distinct, he's done all his research and he's making an informed decision.
Yeah.
And then you support him. He hasn't done his research, you help him get all the information that he needs so he
Mhm.
could make a decision for his life. You're there to support. He hasn't made any done any research, haven't spoken to anyone. He doesn't want to. Again, he has the right not to do that. As a friend, I'm going to support you and be there with you.
Mhm.
Implement these tips in your CASPer responses to secure a fourth quartile score.